10 Nighttime Diabetes Signs. Did you know that, according to the International Diabetes Federation, more than 463 million adults worldwide were living with diabetes in 2019? This number is expected to rise to 700 million by 2045 if current trends continue. Diabetes is a condition where your body struggles to regulate blood sugar. And while it might seem like something you only need to worry about during the day, the reality is that the way your body reacts at night can reveal a lot about your health. When we think about diabetes, we often focus on symptoms like high blood sugar levels or feeling tired. But did you know that diabetes can affect you while you're asleep too? For many people, nighttime can be full of clues that something's not quite right. Today, we will cover 10 nighttime signs you might notice if diabetes is creeping into your life. Let's get started. Quick reminder, we are not doctors. This video is for information purposes only. If you are experiencing a medical condition, don't hesitate to speak with your doctor. Number 1. Excessive thirst. Waking up with a dry mouth and an intense need for water could be a signal that something is off. If you constantly wake up and find yourself reaching for water more often than usual, it might be more than just a random thirst. Here's the thing. When your blood sugar is too high, your body works hard to get rid of the excess sugar by flushing it out through your urine. To do that, it pulls water from other parts of your body, leaving you feeling parched even in the middle of the night. So, if you're reaching for a glass of water night after night, don't brush it off as nothing. It might be your body's way of saying your blood sugar is out of balance. Number 2. Cramps in your lower legs or feet. Do you ever get those painful cramps in your calves or feet that yank you awake at night? If you're dealing with frequent painful cramps in your lower legs or feet, especially at night, it could be linked to diabetes. Those nighttime leg cramps might be a sign that your blood sugar is affecting your muscles and nerves. When blood sugar is too high for too long, over time, it can cause poor circulation and nerve damage. This nerve damage, known as diabetic neuropathy, can really distress your legs and feet, making them cramp up, especially when you're resting at night. Damaged nerves can't send signals to your muscles properly, which leads to those painful spasms that keep you up at night. These cramps can be incredibly painful and disruptive to your sleep. So if you're constantly waking up with those painful knots in your legs, don't just try to sleep it off. It's important to bring this up with your doctor to rule out any underlying conditions like diabetes. Number 3. Frequent urination at night. If you're making multiple trips to the bathroom every night, it might not just be that evening glass of water. Frequent urination, especially during the night, is one of the most common signs of diabetes. When blood sugar levels are high, your body tries to get rid of that excess sugar in any way it can. This is your body's natural defense mechanism kicking in, trying to maintain balance and prevent further complications. One of those ways is through your urine. Your kidneys go into overdrive, working hard to filter out that excess sugar, and this causes a domino effect, which means frequent urination, especially at night. This isn't just an occasional inconvenience. It can significantly disrupt your sleep and overall quality of life. Additionally, this can be particularly taxing on your kidneys in the long run, potentially leading to further health issues if not addressed. Pay attention to how often you're waking up to pee. If it's happening a lot, it may be time to check your blood sugar levels. Before we move on, if you're finding value in this video or any of our other videos, please give it a thumbs up and hit that subscribe button. Your support means the world to us, and it helps us to keep bringing you content you'll love. Thank you. Now back to the video. Up next, number 4, excessive sweating at night. Now, we all sweat a little bit while we sleep, especially if it's hot out or we have a heavy blanket. It's a natural response of our body to regulate temperature. However, there's a difference between normal sweating and excessive sweating that leaves you drenched. If you're waking up drenched in sweat, it could be a sign of something more serious, like hypoglycemia, otherwise called low blood sugar. This isn't just a little bit of moisture. It's the kind of sweating that soaks your sheets and makes you feel uncomfortable. Now, you might be thinking, how can sweating be a sign of low blood sugar? And that's a great question. When your blood sugar drops too low at night, your body goes into panic mode, releasing hormones like adrenaline that can cause you to sweat excessively. It's your body's way of trying to raise your blood sugar levels back to normal. This dip and fluctuation in blood sugar can be particularly dangerous if not addressed promptly, as it affects your body's ability to function properly. By recognizing these signs and understanding what they mean, you can take steps to manage your blood sugar levels more effectively and avoid these uncomfortable symptoms. Number 5. Waking up with a rapid heartbeat. Waking up in the middle of the night with your heart racing can be pretty scary, and it could be linked to your blood sugar levels, especially if you have diabetes. A rapid heartbeat at night could be a sign that your blood sugar levels are dropping too low, also known as nocturnal hypoglycemia. Low blood sugar levels trigger a fight-or-flight response in the body. This surge of adrenaline can cause many physical symptoms, including an increase in your heart rate. Remember, hypoglycemia, or low blood sugar, throws your body into overdrive. Consistently waking up with your heart pounding can disrupt your sleep and might be a sign that your diabetes management needs a little adjusting. Try monitoring your blood sugar levels and make sure you're eating balanced meals throughout the day to avoid those nighttime dips. Number 6. Peripheral neuropathy. Have you ever experienced tingling or numbness in your hands or feet, almost like pins and needles? That could be peripheral neuropathy, and it's a common complication of diabetes. Peripheral neuropathy refers to the tingling, numbness, or even pain you may feel in your hands, feet, or legs, especially at night. This happens when high blood sugar damages the nerves over time, and the discomfort can disrupt your sleep. The thing is, consistently high blood sugar damages the nerves, especially in the extremities. This nerve damage causes uncomfortable sensations that can worsen at night and can lead to a whole host of uncomfortable symptoms like tingling, numbness, burning pain, or even muscle weakness. It's important to catch this early because over time, peripheral neuropathy can lead to more serious problems like foot ulcers or infections, so make sure you bring it up with your doctor if you notice any of these symptoms. Moving on to number 7, sleep apnea. We all know that a good night's sleep is crucial for our overall health, right? But did you know that there's a strong link between sleep apnea and diabetes? Sleep apnea is a condition where your breathing repeatedly stops and starts during sleep, which causes you to wake up gasping for air. This is due to your airways becoming blocked during sleep. It can make you feel super tired during the day, even if you think you slept all night. For people with diabetes, this can be a bigger problem because sleep apnea affects how your body uses insulin, making it harder to control your blood sugar. If you're waking up feeling exhausted or snoring loudly, it might be time to talk to your doctor about getting tested. Managing sleep apnea can improve your sleep and help keep your blood sugar levels in check. Number 8, nightmares. Did you know that fluctuating blood sugar levels can actually lead to more vivid dreams or even nightmares? That's right. When your blood sugar levels dip or spike during the night, it can disrupt your sleep cycle and trigger these intense dreams. Your body's reaction to these blood sugar changes can manifest in restless or unsettling sleep. When blood sugar drops, your brain can become more active, leading to vivid dreams or nightmares as it struggles to maintain balance. If you notice you're having more bad dreams or waking up in a cold sweat, it could be your body signaling that your blood sugar isn't stable at night. It's a good idea to check your blood sugar levels and talk to your doctor if nightmares become a regular thing. Number 9, restless leg syndrome. Do you ever feel this uncontrollable urge to just move your legs, especially at night? It's like an itch you can't scratch, and it's super common in people with diabetes. Restless leg syndrome causes an uncontrollable urge to move your legs, often accompanied by an uncomfortable sensation, and tends to get worse at night. People with diabetes are more prone to restless leg syndrome, likely due to diabetes-related nerve damage, poor circulation, or imbalances in dopamine. When those nerves get irritated, it messes with the signals going to your legs, making you want to move them constantly. Not only can this disrupt your sleep, leaving you exhausted, but imagine trying to fall asleep or stay asleep when your legs just won't cooperate. It can be super frustrating. So if you're experiencing this, definitely bring it up with your doctor. There are treatments available, from lifestyle changes to medication, that can help you get some much-needed relief. Number 10. Gastric reflux or GERD. Have you ever woken up in the middle of the night with a burning sensation in your chest? It's a feeling that can be quite alarming, almost as if your chest is on fire. Gastric reflux or GERD is common in people with diabetes, and it can flare up at night. This happens when stomach acid flows back into your esophagus, causing discomfort and disturbing your sleep. High blood sugar can cause delayed stomach emptying, leading to acid reflux, especially when lying down. It's a common condition that many people experience from time to time. Now, while experiencing this occasionally might not be a big deal and can usually be managed with over-the-counter medications or lifestyle changes. But here's the thing, it could also be linked to diabetes, given that uncontrolled diabetes can have a significant impact on your digestive system. High blood sugar can actually damage the vagus nerve, which is responsible for many important functions in your body. It plays a crucial role in controlling the muscles in your stomach and intestines. This nerve helps regulate the movement of food through your digestive tract. When this nerve isn't functioning properly, it can lead to a condition known as gastroparesis. It can slow down digestion, resulting in increased pressure in your stomach, causing food to hang out in your stomach longer than it should. This delay can cause a range of digestive issues. One of these issues is forcing stomach acid back up into your esophagus, which can be quite uncomfortable. The esophagus is not designed to handle stomach acid. This backflow of acid is what causes that uncomfortable burning sensation. If you're experiencing frequent heartburn or gastric reflux, especially at night, it's important to take it seriously and is definitely worth having a chat with your doctor. They can help you understand the underlying causes and provide appropriate treatment options. Here are some additional tips to help manage diabetes, especially at night. It's important to focus on eating balanced meals throughout the day to keep your blood sugar stable. Stay hydrated, but try not to drink too much before bed so you're not running to the bathroom all night. Having a consistent sleep routine can do wonders for your rest, and regular exercise is excellent for both blood sugar and circulation. Just avoid working out right before bed. Keeping stress levels in check is also key, so try some relaxation techniques like deep breathing or meditation before you hit the sack. This will help you wind down. Don't forget to monitor your blood sugar, especially at night, and talk to your doctor if you notice any changes. Little adjustments can make a big difference. And that's it for our look at nighttime signs of diabetes you should watch out for. Thanks for watching. We hope this video has been informative. If you found it helpful, hit the like button. Please remember to comment, share, and subscribe for more. Until next time, take care of yourself and each other.